KCTV5 News is investigating your complaints when it comes to health care.
A reoccurring theme are medical complaints. You're calling us from hospital rooms and after you leave your doctor's office frustrated with what just happened.
Investigative reporter Angie Racono shows you how to complain.
Complaining is about getting some results and resolution. The man you are about to meet says he became alert during a procedure and he could feel the cuts. He even asked his doctor to stop, but that didn't happen.
It was hurting real bad. It was hurting up inside real bad. I would jump and jerk each time he was cutting polyps out.
Mark Howell is describing what he says happened to him during a colonoscopy procedure at the VA. He was supposed to be consciously sedated and not feel a thing. Mark suspects medication simply wore off.
Feeling this incision, the cutting and the burning, and I'm like, "You're hurting me," and he would not stop.
He says as he was being sedated, he could hear people discuss which team was performing colonoscopies faster.
They've got one, and another team had two, and they're like, "Well, we're way ahead. We're on 4 now. After this, we're taking our lunch."
A half hour in, Mark says he could feel the pain, but the doctor decided to just push through.
"I feel this." He says, "We're just about done." I says, "I don't like this. Stop."
Mark says he complained to a recovery nurse after the procedure.
I kept waking up and it hurt. I said, it kept hurting and they wouldn't stop. And she says, "It's over with now. You're doing fine."
Things aren't just fine with Mark. He's now formally complaining. Here's what all patients should do. Address problems directly with the medical professionals around you. Ask for the patient advocate. Most hospitals have them. That person can step in and help you out. If you are unsatisfied, you can contact the Healing Arts Board in Kansas or Missouri. That's where you can file a complaint about doctors and nurses. We contacted the VA and they promised to look into any complaints and said the patient advocate is the best way for a patient to lodge a formal complaint. That's what Mark did, but he was unsatisfied with the response, so he followed the next step.
I have called the General over Healing Arts, and they instructed me to talk to the VA, the head VA.
Mark also asked for a copy of his medical file, so he knows what level of sedation medication doesn't work for him.
I mean, I don't understand why a doctor or a physician wouldn't just stop if you know your patient's hurting and he needs more anesthesia or he's feeling this. It didn't make sense to me.
There are other medical complaints. If you feel your room is cold or filthy or the food isn't safe, you should contact the State Department of Health Services. We are listing all of this information on our website. Angie Racono, KCTV5 News.